So if you're only missing one tooth, why a dental implant over a proven traditional bridge?
Bridges are what I would consider old school these days.
Okay.
You have to go in and cut down healthy tooth structure in most cases to be able to connect 3 teeth that look like, or to replace 1, I should say.
Okay.
Dental implants have become the golden standard for replacing individual teeth, or if it's a whole section of teeth, we can do multiple implants and make a bridge on that. That's not relying on old teeth that have already had fillings and crowns and maybe somewhat broken down already. So the strength factor, the longevity is through the roof with these procedures.
What about pain with that single tooth implant?
Generally, we offer IV sedation, Randy, but for the most part, a single tooth or a couple implants, the patients are just going to get local anesthetic. We're going to start with topical anesthesia to numb the gum. We're going to get them numb that way, and the patients are happy.
What about cost in the long run? I mean, what's cheaper, the implant or the bridge?
In years past, it used to be more expensive for the implant, so patients would come in asking for the bridge. I saw that as an issue, so I corrected that. Now the cost is going to be roughly the same.
Nice.
In my practice, I don't even do bridges anymore.
Which one lasts longer?
You can imagine that the tooth that's dependent strictly on its own support, that's the dental implant, versus relying on 2 older, maybe somewhat broken down teeth for a bridge. You can do the math and realize that the single tooth implant is going to be the one that's lasting a lot longer.
So somebody in your own family was over 18 or fully grown and was missing just 1 tooth. Would you always go implant over bridge?
I would lean that way. I would always recommend the implant. Cleaning is so much easier as well. There's special floss threaders and things like that that have to be used with these old school bridges that now just regular floss, regular toothbrush. This is not a tooth that comes in and out, Randy. This is going to be a tooth that feels natural. That's why it's the golden standard these days. And many times I see these patients on recall a year, 2, even 10 years later, and they remember getting an implant with me. They just can't remember which tooth it was.
Is that right? And eating, how soon can they eat after it's done?
The day they leave with the tooth in there, they can eat. Usually there's not going to be anesthetic on that appointment, and they're going to be going and eating like they never lost that tooth in the first place.